In the summer, the kids do fall down. They do get fractured wrist. And there are different types of fractured wrist. Could you just discuss that just a little bit?
The most common fractured wrist is what is called a green stick fracture or a torus fracture. And green stick fracture essentially means like if you take a green stick and bend it, it would bend but not break because the bones in children are rubbery. And so they get a little bend or a little buckle in the bone, but the bone is intact. That's what we see most commonly. Then you have a fracture of the wrist where the bone is broken through, completely through and through, but it's not displaced. That's a great fracture to treat because all you need is a splint or a cast. And then you have a bone that is broken and it's out of place. And so those you have to sometimes put the children to sleep to reduce it. And then the last variety is where the growth plate is involved. When the growth plate is involved...
First of all, most people don't know what you mean by growth plate. What do you mean by growth plate?
A growth plate is a part of the bone where the bone grows in length. The way the children become taller is they add bone at the top part of the bone and at the bottom part of the bone, for example, in the tibia. Or how the arm will grow, there is growth plate at the wrist end of the bone, and there's a growth plate at the elbow end of the bone. And that's where the bone grows, and that's how the arm becomes longer.
And they look at an x-ray. Is there something they would look on the x-ray and say, this is a growth plate fracture over a non-growth plate fracture? Is there anything they look for?
Yes.
What do they look for?
The growth plate should be straight. And if there is any abnormality in the growth plate or a fracture that passes through the growth plate, that's an epiphyseal fracture or a growth plate fracture.
When you get a growth plate, do you have to handle that a particular way?
Yes. The growth plate fractures are of 5 different types. The most difficult of all the growth plate fractures is where the growth plate slides off. And so half the growth plate is a little bit away and the other half the growth plate is a little bit proximal to the joint. And those we have to reduce and sometimes pin them or fix them with a screw or whatever has to be done.
So when you put it back in position, does it mean it'll start growing like it should?
Sometimes they develop what is called linear deformity or angular deformity, but that's because the cells within the growth plate are so damaged that there is not much you can do about it.
So if you get a linear growth rate of that type, what's some other ones?
The last one and the most difficult one is a growth plate fracture where the fracture extends into the joint. And now the articular surface may be in place, which does not cause a big problem, but the articular surface, the joint surface, is displaced. That's the fracture that always requires surgery.
And if you do surgery, it's no guarantee you're going to have success, is it?
You will not have guaranteed success, but at least you'll have something better than what you would get if you leave it alone.
And many times you use all kinds of metals and hinges and things, almost like a carpenter, don't you? So actually you're like a carpenter a little bit, aren't you?
We are like gardeners. We like to consider ourselves as people dealing with wood, but how to grow the wood properly. Carpenters only cut the bone. They are cutting really...
Well, you're a finished carpenter then.
I'm a finished carpenter.
Okay, you make fine cabinets out of the wood. But the main thing is, if there's any concern for a growth plate, that is a red flag that you've got to do something. Not a week from now, right away. Is that correct?
Right away.
We don't look at holidays. It's an emergency.
Whether it's a holiday or no holiday, that is one fracture that needs treatment very early.
And it's very common in pediatrics, if they have a wrist on one side, you worry about a fracture. Sometimes you take an x-ray of the other wrist to compare, because it's sometimes difficult to see these things accurately. Is that true?
Absolutely true, because in children, certain parts of the bone at the joints are not calcified yet. And so the x-ray is not going to show a fracture through the non-calcified part. That's like a soft tissue. And so with the x-ray, you can only make diagnosis of calcified bone. If there is a fracture of the end of the bone in a child that's not calcified, you can miss it easily. The only way you can do is to compare the two sides to be able to detect
And
minor
sometimes you have
defects.
to take an X-ray even a few days later to see there's some changes. Is that
Yes.
true?
Yes, you can take X-rays a few days after the fracture has occurred, and you will see some healing around the fracture, and that's how you can make a diagnosis also.
But sometimes they do MRIs. Is there any gain in doing an MRI in a fractured area?
There are certain fractures, even if you compare the two sides, you cannot clearly make a diagnosis. And so, if there are fractures of the elbow, mainly the elbow in children, the only way you can make a good diagnosis is if you get an MRI and see that the entire bone and the soft tissues are normal, or there is discrepancy or break in the bone and the soft tissue.
And what we can visualize can tell you approximately how old the kid is. Is that true?
Yes, the growth pattern, or more specifically, the calcification pattern of the 8 bones, the 8 marbles in the wrist, can tell you how old the child is.
You look at the wrist and you see these little ossicles, and by the number that's visualized, you can tell sometime about the age. Is that correct?
Yes.
And sometimes you see more of them. It's accelerated is an indicator of sometimes an endocrine problem, or the opposite's true. Kid's not growing correctly, and there's less bone. So you can actually say, I see something, and then say, you don't have to see an endocrinologist. Is that correct?
That is true. Certain changes in the number of bones will occur in endocrine diseases, or they could be birth defects, or sometimes instead of 8 bones you see 7 bones, because the bones are fused with each other, what we call synostosis. There is one condition called Nievergelt-Perlman syndrome that was named after Dr. Perlman from Brooklyn, where the bones are less in number.
That was your former partner?
That was my former partner and my mentor and my professor, my philosopher and a friend.
Lovely man. I knew him for a long time. Also, some conditions, some medicines can make bones more friable. Is that true?
Yes.
Like sometimes steroids sometimes can do that.
Steroids very often cause softening of the bones, what we call osteoporosis, and many of the children that have immunological disorders that take osteoporosis, their bones are fragile and break easily.
So the basic rule is if you see an injury, you should contact your primary care physician to help you judge what you should not do. But sometimes the best well-meaning situations, it's sometimes very difficult to diagnose a fracture, especially a young child. Is that correct?
In a young child, diagnosis of a fracture is a lot more difficult than an adult. And oftentimes you have to see how the child is playing, whether he's avoiding a certain part of the body, if he does not use a part of the body, does not bend certain part of the body. That's how clinically you can focus on a fracture in a child.